This is to measure volume or edema in the affected extremity. This is the volumeter, this is the beaker, and this is the cylinder, and these are the three parts for this. So the only contraindication of this, per the literature, is if there's an open wound. And we're going to go ahead and use a different type of measure for that. You can place the hand in the first and second digit web space or between the fingers here. If there's a large amount of swelling and there's pain, this would be difficult for the patient to do. So you can offer this option. As long as you're consistent each time you measure, you will get an accurate number. So we're going to go ahead and go between these two fingers. Whitney, you're going to put your hand down on that bar. And just rest there. Hold that position. And when the water stops running into the beaker, stops dripping, she will slowly remove her hand. And I will go ahead and help her dry it off. When you're ready. So what we are measuring is the edema or swelling of the hand by the amount of water that is displaced into the beaker. And the purpose of measuring edema or doing any type of upper extremity assessment is to see where there's functional deficits, or could there be functional deficits. So at this point, I will take out the cylinder, take the beaker of water, transfer it, and we'll do an eye level measurement. Please join me, Whitney. Come on down and look at that measurement together. Remember, this is in increments of 5, and it's in milliliters. So we know we've passed the 300 mark, and we're just above that.
305.
Would you agree with me that it's 305 milliliters
Yes.
of water that's displaced?
Yes, ma'am.
And there is no formal measurements or norms for this because of the difference in each person's hand. So you will compare to the other hand, and then a week later, you will re-look at the measurement. Something to keep in mind with edema. You want to measure it at different times throughout the day to get a baseline. Once you get the baseline, you can decide how you want to measure it. But we don't know when the hand is, or the extremity is more swollen. So initially, you're going to measure it throughout the day, morning, afternoon, before treatment, after treatment, to get your baseline of when there's more swelling and what you can do for your OT intervention. If there is an open wound, as I shared earlier, we're going to go right into the measurement in centimeters for circumferential measurement, and I will demonstrate that now with Ms. Whitney. Okay. Just so she's not on a hard surface, always prop the elbow onto something cushy. So what we're doing right now is you can take any kind of circumferential measurement, but I like to do 2 to get a feel. If all the fingers are affected, you may need to take a digit measurement of each one. But right now I'm going to demonstrate it with 1 digit. We're going to document this in centimeters. If it happens to be less than 1 centimeter, then it would be in a millimeter. So the 2 measurements we're going to do is the distal palmar crease, starting at the ulnar border and coming around to just the base of the MP joint. Again, distal palmar crease, starting at the ulnar border, coming around to the base of the MP joint. And it will be circumferential. So I will do that first. The hand is going to be relaxed. Again, I'm at the crease. The hand is going to be relaxed, and then I'm going to read the measurement from 0. Remember that this is large numbers to start off with. So I know that the 20's here, so I know I'm closer to what I would call 18. So 18 centimeters is the circumferential measurement. And again, here's my line at 0. Here's my 18 as it comes around because this is a 20. So again, it's not an 8 It is an 18 because I see my large 20 is here. So please, when you're reading this in centimeters, keep an eye on the 10 centimeter and the 20 centimeter, so you know indeed that your circumferential measurement of your distal palmar crease will be a larger number. It should be around 16 to 20, depending on the hand size. So she has 18. Now, if there was excessive edema, it might even be larger than 20. Now we're going to do a distal measurement. You can certainly use the same tape measure, but we happen to have some nice digit measures. Okay, again, we're going to do this in centimeters for a more accurate measurement. If it's less than 1 centimeter, then you would have a millimeter measurement. And let's see about the pinky. I'm going to suggest that we do it between the MP and PIP joint on the phalanx. On the MP, between the MP and PIP joint on the phalanx. It comes right through the measurement tool. Thank you. Okay. Again, this is in centimeters. This is about 1/3 of the number than the circumferential measurement. So that's another guide for you. So the circumferential measurement of the hand will be about 3 times a digit measurement. About 3 times. This is a small finger, so keep that in mind. And this is approximately 5.4 centimeters. I've got my 5. I've got my 5 here. That would be 5.5, but it's approximately 5.3 to 5.4 centimeters. And that's how I would document that. Just to remind everybody, when you're doing upper extremity assessment as an occupational therapy practitioner, you're doing it to see if there's any functional deficits. If you find out somebody has a limitation in daily living, whether it's feeding, grooming, or dressing, you do the physical assessments to find out, standardize what's the problem, and how off are they for the norm for their age. Going by these measurements, we can take objective data and see the changes in strength, in pinch, in volume or edema, range of motion. And we can really see the changes in a standardized test as well as assess it as CODIS in the ADLs that we do daily with our patients. Again, if you need to adapt the norms, do them consistently each time you test the patient. Make a note if they're not sitting. If they're standing, please make a note of that as well. Thank you again for your time today, Ms. Whitney. It was a pleasure.
Thank you.